Hello again, this is Dr. Halbert here in the office at Parkrose Chiropractic on Northeast Sandy. Today, I'm going to talk with you a little bit about breathing. Now, keep in mind, I can't tell if this will be right for you without a proper physical and history, so if you have any breathing conditions or any concerns as to whether or not you're healthy enough to do what I'm going to show you, consult your doctor before trying it. Now, I know breathing exercises seem perhaps a little silly. You and I have both been breathing our entire lives, and we should be pretty darn good at it by now. Besides, what does it have to do with health anyway? Well, a lot, actually. It's important enough that your brain takes care of it for you, even when you're not thinking about it, whether you're watching a movie, sleeping, or going for a jog. Our bodies are filled with cells. These cells rely on various nutrients to keep running and doing their jobs well. One of the most important nutrients is oxygen, and our lungs are filled with an endless lattice work of membranes to help us get it. The membranes are so thin, you literally exchange gases through them to get oxygen from the air into your blood, and eventually to the many cells of your body. Okay, so that's why we breathe. I want to focus on how we breathe. Proper breathing is associated with not only getting oxygen to your blood, but also with reducing muscle tension, improving joint motion, reducing stress, and sometimes even reducing pain. So try this. Put one hand on your chest and one hand on your belly. Take a normal breath. Now, take a nice, slow, deep breath. Like I just showed you, most of us will feel our chest fill up nice and big with maybe just a little motion in our belly. While it may look impressive, it's not quite ideal. In fact, it can cause some problems. When we breathe this way, it overactivates the muscles that help us breathe deeply when we really need to, like when we're being chased by a mountain lion. But these muscles are not supposed to be working so hard all the time, and eventually they get more and more tight and overworked. This muscle tension can lead to headaches, increased feelings of emotional stress, and even sometimes cause or exacerbate conditions leading to pain. If you breathe into your chest the way I described, it might be because you spend a lot of time sitting, which makes it tougher to breathe properly. Perhaps you were never taught how to breathe properly, or maybe it's because, frankly, it's not that attractive to stick your belly out like you're supposed to. Whatever the reason, I encourage you to breathe as follows. Put your hands on your chest and your belly like we did before. Now, breathe only into your belly and let it stick out as it fills with air. Do your best to keep your chest from moving. You can watch your hands while you do this to try to get it so your belly moves and your chest doesn't. It should be kind of difficult at first because you've probably been breathing into your chest for years. Give it time, go slow, and don't give up unless you start to feel woozy. But keep practicing this every day until you breathe into your belly, even when you're not trying to. Eventually, those overworked muscles will begin to relax, letting your diaphragm do most of the work like it should. That way, you can save those extra muscles for when you really need them. I'm not saying this little exercise will save you from a mountain lion, but I'm saying it might just help. So as always, forward these tips on to anyone you know who might benefit from them, and check back next week for more. Thank you.